morning, Dr. Shrivastava. How are you doing?
Hi, good morning. How are you today?
I'm good. So I'm here to review your book.
Yeah, thank you.
So it's called Science of Success. Am I right?
Yeah, it's
Okay.
about success and failure.
Okay.
So I must tell you that a lot of people who deserve to succeed, but they don't, because they blame the luck if they do not succeed. But that's not the case. In fact, they have to pay attention to their mind and brain and psychological function, which interferes in their preparation and their performance.
So, who are you targeting this book to?
Yes, the book is targeted to university students, those who have passed out and trying to go for a job or employment, and those who have succeeded in their employment and want to go further. And it is important to know that succeeding once does not guarantee you succeeding forever. About 50% people fall out. They don't maintain their success, develop psychological problem. Those aspects has been discussed in this book.
And does this have anything to do with you being a professor at a university?
Well, I think it's a good question. The motivation to write this book has come from memory of those individuals whom I have met in my long career. So I met students, their girlfriend, their family members. I have known their success, their failure, and the causes about it. And one thing, if I can tell you, is that what stands between success and failure is your psychological health. That's the bottom line that's the key message of this book.
So, can you define a little bit more specifically what you mean by psychological health?
Yes. See, people need to understand that psychological health is a normal component of life. So the problem of memory is not a problem. Memory, emotion, how you cope with the stress. So these capacities, they come in the field of psychological field. But then many times they are challenged. These psychological factors or environmental factors are so strong that people cannot cope. And they develop symptoms, but they don't realize that they are having. For example, somebody is sleeping more, somebody is eating more, somebody studies and forgets. So they are really not able to understand, because they are not sick, they are not ill, but they are in between. They are not all that normal and they are not sick. So this transition needs to be identified because it can be treated.
But surely, if you are a college student and you are studying for your vocation, sleeping and eating is not as important as studying and making money.
Yes, in a way you are right, but the fact is that it is important, because that's normal function of life, and you want your body to function normally. Unless you are ready for it, unless you are fit mentally and physically, you cannot really perform. And if you are sleeping too much, it may be a sign of depression. And if you are depressed, your memory is impaired, you cannot solve problems, so you remain very stressed. So if you cannot solve the problems which you have studied and you cannot perform, you are more stressed. The moment you are more stressed, the problems are more. So you may be working hard and you think you are working hard, but your output and productivity is not as much as expected.
But you said depression. I mean, we live in 2021. Everyone knows depression. If you have depression, they'll just go to the doctor, or why read a book about it?
Oh, yes, depression is common. Maybe 30-40% of students and young people do suffer. But there are varieties. Varieties are, some people have feelings of hopelessness. Some people have hopelessness plus helplessness. They don't experience it is depression. It is very difficult to diagnose and identify because of lack of awareness. For example, how many people know that lack of concentration or lack of appetite may be a sign of depression? So we need a lot of awareness about symptoms which are seen in depression, and also certain warning signs that when a person should go for treatment, when a person should go for counseling. And it's best to keep talking and discuss with your friends, families and relatives and resolve their problem.
It's a nice thought, but I'm feeling that you might only capture a very small segment of the student population. If student is your main target, how are you going to make it as widespread as possible? There are people who do fantastic and they live completely normal lives. Only the students that have the problem feel that they need to solve it. How will you spread it to?
Yes, I mean it's most important question. But let us remember, who is the student who does not want to succeed? So everybody wants to succeed, and I am discussing the problem of success and the psychological problems which block the pathway of success. So in that way, I will capture the problems of succeeding, the psychological problem, as well as the psychological problem which are present, which lead to a failure or setback in the career. So everybody wants to succeed. So I'll be able to capture psychological problem of everybody. I only need people to be aware. And that is why here is a book. It captures my experience that how depressions, anxiety, OCD interferes with life.
Okay. And how does this book separate from other books about self-help?
Yes, the self-help books do not much concentrate on psychological medicine point of view. So they would tell you that go exercise, do have a nice type of nutrition, and they say how to relax. But here the focus is not just to relax. Here the focus is to find a global symptoms. We want to determine why are you suffering and how to help you. So you may do a lifestyle treatment, plus you may require many more type of treatment. I mean, I don't say that 80% don't work, but they just work in 30-40% of people. But still, people having severe depression will require medication. So it's a matter of identifying. So that's more of medical and psychiatric point of view, which I see is very broad and is distributed in the community of students. And in fact, it is life-saving, because about 20 to 30% students anytime in any university or college have suicidal ideas. And if I have to tell somebody who is at risk for suicide, I would say if somebody has ideas of suicide, they are the best and definite marker that this person is at risk. So that's the purpose of the book, and I hope and I'm confident that it will become popular among students.
Okay, and you're talking about medications and treatment. What do you think about students taking this medication for studying, or they take stimulants, or they say...
In fact, yes. So this is another type of psychological problem. So let us see, some people have stress, some have more than stress symptoms, that is psychological ill health, and some have psychiatric diagnosis, psychiatric illness. And substance abuse or addiction is a part of a mental health problem. It is classified as mental illness. So that means the students who have felt the need to stimulate their sleep or need more performance, and they consume alcohol or other drug. In fact, they are dealing with substance abuse. So we have to deal with that kind of person. We need to talk to them that there are other ways to perform, there are other ways to remember. You do not need to deprive yourself from sleep by taking stimulants. Now, if somebody has to take stimulants, that means he's sleeping more otherwise, or his brain becomes more stressful. They cannot tolerate, or they cannot reproduce. So therefore they take medication for that. And we want to exactly tap this so that we can help this.